Welcome. If you are over 50 and you have noticed that something has quietly changed about the way you move through the world, the way you pause at the top of a staircase now, the way you reach for a handrail that you never used to think about, the way you watch the ground in front of you on an uneven sidewalk with an attention you did not used to need, then this video is for you. And I want to start by telling you something that I need you to actually believe before we go any further. What you are experiencing is not permanent. It is not inevitable. It is not simply what getting older feels like, and therefore something you must accept and organize your life around. It is a skill that has gotten rusty, and skills that have gotten rusty can be sharpened again. Not someday, not with equipment you do not have or time you cannot find. Today, in the next 30 minutes, in whatever room you are standing in right now. My name is Dr. Clarence Martin, and this channel exists for one purpose: to give people over 50 real, practical, science-backed information that they can use in their actual lives. Not theory, not inspiration, actual tools. If you are new here, please subscribe and turn on notifications because we publish content regularly that is specifically designed for where you are right now. Today, we are going to do two things. First, we are going to test your balance, not to embarrass you, not to give you a number to feel bad about, but because you cannot improve something you have not honestly assessed, and because the two tests I am going to walk you through will tell you, with more accuracy than most people expect, exactly where your balance currently stands and what it means for your day-to-day safety. Second, we are going to work 5 exercises, specifically chosen, specifically sequenced, targeting the exact muscles and neurological systems that control your stability and that, in most people over 50, have been significantly underused for long enough that they have partially switched off. We are going to switch them back on. But before we do anything else, I need to talk about safety. Please do not skip this part because you feel confident. Confidence and balance are not the same thing, and one of the things the tests are going to reveal is that people who feel confident about their balance are sometimes the ones who are most surprised by what the test shows. Find a corner of your room, an actual corner where 2 walls meet. Stand facing into it so that if you lose your balance in any direction, a wall is within arm's reach. Alternatively, position yourself with a sturdy chair in front of you and a wall behind you. The chair should be one you can grab, not a rolling chair, not something lightweight, something solid. If at any point during the tests or the exercises you feel dizzy, not slightly off balance, but genuinely dizzy, the room moving, stop immediately. Sit down. Do not try to push through dizziness. This is not a test of toughness. It is a test of balance, and dizziness is your nervous system telling you something that you should listen to. Everyone set? Good. The first test, tandem stance. The first test is called the tandem stance. You may have seen a version of this if you have ever watched a roadside sobriety test on television, which tells you something about how sensitive this position is as a measure of neurological balance function. The brain, when asked to manage balance on a very narrow base of support, reveals very quickly how well its balance systems are currently working. Here is how to do it. Stand up straight. Place one foot directly in front of the other so that the heel of your front foot is touching the toes of your back foot. They should be in a single straight line, not side by side, not slightly staggered, but heel to toe, one directly in front of the other. Cross your arms over your chest. This removes the option of using your arms for balance, which people do unconsciously and which would make the test easier but less accurate. Now look straight ahead. Pick a point on the wall in front of you, a light switch, a picture, anything at eye level, and focus on it. Do not look at your feet. Your brain uses visual input as one of its 3 primary balance systems, and you want to keep it engaged. Now simply stand there. I want you to hold this position for 30 seconds. Count in your head or watch a clock if you have one nearby. Do not start the timer until you feel stable in the position. Getting into the position takes a moment. Let yourself settle and then begin. Go ahead. I will wait. Here is what your result means. If you held the tandem stance for the full 30 seconds without touching anything and without significant wobbling, not perfect stillness because nobody is perfectly still, your body is always making micro adjustments, and that is correct. That is healthy. Your balance system for this test is functioning at a good level for your age group. That is genuine good news, and it means the exercises we are about to do will be maintenance and strengthening rather than remediation. If you held it for between 15 and 29 seconds, your balance system is working, but it is working harder than it should be. There is room for significant improvement, and the exercises we are going to do are going to feel challenging in a way that tells you we are working the right systems. If you held it for less than 15 seconds, if you had to step out of the position or grab the wall before 15 seconds passed, I want you to hear this clearly and without alarm. You are exactly where many people over 50 are, and you are in exactly the right place, watching exactly the right video. The muscles and neurological pathways that control balance respond to training faster than almost any other system in the body. People who cannot hold this position for 10 seconds when they start training can hold it for 30 seconds within 6 to 8 weeks. This is not unusual. This is what the research consistently shows. Write down your number, or remember it. We will come back to it. The second test. Single leg stand. The second test is more demanding than the first. It is called the single leg stand, and it is one of the most widely used clinical assessments of fall risk in older adults. Researchers and physical therapists use this test specifically because it has been shown across multiple large studies to predict fall risk with significant accuracy. A person who cannot hold a single leg stand for a specific duration has a measurably elevated risk of falling in the next 12 months. I am telling you this not to frighten you, but because I think you deserve to understand what you are actually measuring and why it matters. Here is how to do it. Stand behind your chair with both hands lightly resting on the back of it. Lift one foot off the floor. Bend the knee so your foot comes up behind you, not forward, and find your balance on the standing leg. Once you feel stable, take your hands off the chair. Arms can be out to your sides for balance, which is fine for this test. Look straight ahead, the same fixed point on the wall. Now hold it. I want you to aim for 30 seconds. Start your count when you feel stable, not when you first lift your foot. Go ahead. Here is what the research tells us about this test. Adults in their 50s who have good balance should be able to hold a single leg stand for 40 seconds or more with eyes open. If you held it for 30 seconds or more, your single leg balance is functioning well. Adults in their 60s, the research is consistent here across multiple studies, show a significant drop in single leg balance time. If you are in your 60s and you held it for 20 seconds or more, you are in a reasonable range. Below 20 seconds is where the fall risk data begins to show a meaningful signal. Adults in their 70s, 15 seconds or more indicates good function for your age group. Below 10 seconds in your 70s is associated with significantly elevated fall risk and should be treated seriously. Adults in their 80s, 10 seconds is a meaningful benchmark. Many people in their 80s who present to physical therapy after a fall cannot hold this position for 5 seconds. If you are in your 80s and you held it for 10 seconds or more, you have something to build on. Whatever your number was, whatever age you are, write it down. This is your starting point. In 6 weeks of doing the routine I am about to show you, this number will change. For the majority of people who do this consistently, it will change significantly. Now we work. 5 exercises. I'm going to explain each one before we do it, walk you through the correct form, tell you what muscles you are targeting, and why those specific muscles matter for balance, and then we will do it together. A note on intensity before we begin. These exercises are designed to be challenging enough to create adaptation to actually change the muscles and neural pathways that control your balance, but not so challenging that they are dangerous. You should feel work. You should feel some muscles that have not been asked to work like this in a while. That sensation is correct, and it means the exercise is reaching the right places. Pain is different. Sharp pain, joint pain, pain that feels like an injury rather than an effort. Stop if you feel that, and consult your doctor before continuing. Ready? Let us begin. Exercise 1. Heel to toe. Walking. This exercise trains the same system that the tandem stance test assessed, your brain's ability to manage balance on a very narrow base of support, but it adds the complexity of movement. Static balance and dynamic balance are related but not identical. Most falls happen during movement, not while standing still, so training the moving version is essential. Find a clear line on your floor, a floorboard edge, a tile seam, or simply imagine a straight line, and you are going to walk along it. Heel to toe. Each step, the heel of the advancing foot meets the toes of the back foot. 12 steps forward, then turn and come back. Arms out to your sides for balance. Eyes up and forward, not down at your feet. Looking down shifts your weight forward in a way that makes this harder than it needs to be, and also removes the visual anchor that your balance system is using. Walk slowly. This is not about covering distance quickly. It is about the quality of each placement, the controlled transfer of weight from one foot to the other across a narrow line. Let us do 2 lengths. Forward and back is 1 set. Go. Feel that? If this was harder than you expected, that is useful information. The muscles of your ankles, particularly the peroneal muscles on the outer ankle and the tibialis on the inner, are working to make micro-adjustments with every step. Your brain's cerebellum, which coordinates balance, is actively processing feedback from your feet, your inner ear, and your eyes, and translating that into the tiny corrections that keep you on the line. All of that is training. All of that is getting stronger with each repetition. Rest for 30 seconds. Then we do 1 more set. Exercise 2. Standing calf raises. The calf muscles, the gastrocnemius and the soleus, are sometimes called the second heart because of the role they play in pumping blood back up from the lower legs. But for our purposes today, their role in balance is what matters. Every time you take a step, every time you stand up from a chair, every time you navigate a curb or a step, your calf muscles are one of the primary stabilizers that prevent you from going forward onto your face. Weak calves are directly associated with increased fall risk. Strong calves are one of the most significant protective factors for stability in older adults. Stand behind your chair with your fingertips resting lightly on the back. Not gripping, resting. We are using the chair for safety, not for support. Rise up onto your toes. Both feet together, as high as you can comfortably go. Hold at the top for a full second. Do not rush through the top position. The hold at the top is where a significant portion of the strengthening happens. Then lower slowly. The lowering phase should take about 3 seconds. Controlled. The muscle works on the way down as well as the way up. We are going to do 15 of these. Ready? Rise, hold, and down. Slowly. Good. Rise, hold, and down. Continue at this pace. Rise, hold 1 second, lower over 3 seconds. 15 repetitions. If that was easy, we can make it harder. On the next set, try it on 1 foot. 1 hand on the chair for safety, but the work on a single calf, which doubles the demand and begins to train the single leg stability that the second test assessed. Rest, 30 seconds. Then, the next exercise. Exercise 3. Sit to stand. This exercise is deceptively powerful. Getting up from a chair is one of the most common moments when falls occur. The transition from seated to standing involves a rapid shift in center of gravity, a demand on the quadriceps and glutes that many people over 50 find genuinely challenging, and a brief moment of postural instability that the balance system has to manage quickly. We are going to train this transition deliberately. Sit in your chair, feet flat on the floor, about hip-width apart, hands on your thighs, not on the chair arms, not pushing off with your hands. Lean slightly forward from the hips, not a dramatic lean, just enough to shift your weight forward over your feet. This is the correct mechanics of standing. Many people who struggle to stand from a chair are not actually too weak. They simply have not shifted their weight forward before trying to rise, which means they are fighting their own center of gravity. Now stand, controlled, using your legs, not your arms. At the top, stand fully upright. Do not hunch forward. Find your balance for a full second at the top, then lower back down. Slowly. This is not sitting. This is controlled lowering, which is harder than standing up and which is training the eccentric strength of your quadriceps and glutes, the strength that prevents you from dropping into a chair or onto a toilet seat rather than lowering into it with control. 10 repetitions. Slow on the way down. Go. If this is challenging, that information is important. The sit to stand is a functional movement you perform dozens of times every day. The strength and coordination it requires is directly connected to your independence, your ability to get up from any chair, from a low couch, from the floor if necessary. We are not exercising for exercise's sake. We are training the specific movements that daily life requires. Rest. Then, the next exercise. Exercise 4. Single leg balance with movement. This builds directly on the single leg stand test, but adds a component that makes it more functional: movement of the upper body while maintaining single leg balance. In real life, you almost never need to stand on one leg while staying completely still. But you frequently need to stand on one leg while your body is doing something else, reaching for something on a high shelf, turning to look behind you, picking something up from a lower surface. That is the scenario where falls happen. And that is what this exercise trains. Stand behind your chair, one hand available for support. Lift your right foot off the floor, just a few inches, enough to be clearly off the ground. Now, while balancing on your left leg, slowly reach your right hand forward as though you are handing something to someone at arm's length. Then bring it back. Then reach to the right side. Then back. Then reach slightly across your body to the left. Then back to center. Each reach shifts your center of gravity slightly and requires your standing leg to respond and compensate. Your ankle, your hip, your core, all of it activating to keep you stable while your arm moves through space. 5 reaches in each direction. Then switch legs. Go slowly. If you need the chair initially, use it. As you get stronger over the coming weeks, try to use it less. Exercise 5. Heel raises on one leg. The last exercise brings together everything we have built: ankle strength, single leg stability, controlled balance, and adds the most demanding element, the calf raise performed on a single leg. This is the exercise that, if you practice nothing else from this video, will produce the most significant improvement in your fall resistance over the next 6 to 8 weeks. The research on single leg calf raises in older adults is remarkably consistent about this. Stand behind your chair. Lift your left foot slightly off the floor. You are now on your right leg only. Rise up onto the toes of your right foot. As high as you can go. Hold for 1 second. Lower slowly. 5 repetitions on the right, then switch to the left. This will be hard. Harder than the double leg version in a way that surprises many people. That difficulty is the point. The ankle and calf and the entire balance system of that single leg are being asked to do something demanding, and demanding is how they get stronger. If you cannot yet do this without holding the chair, hold the chair. Use one finger if you can manage it. Even minimal contact with a stable surface dramatically improves balance, and using one finger is already training the system while providing safety. Over weeks, you will need the chair less. That is the routine: 5 exercises, done consistently, every day if possible, every other day at minimum. This routine will produce measurable changes in your balance within 4 to 6 weeks. The tandem stance and single leg stand numbers you recorded at the beginning of this video will increase. The movements that feel difficult today will feel easier. The confidence that left quietly over years will begin to return. Not all at once, gradually, which is exactly how it left. I want to close with something I think is important to say plainly. Falls are the leading cause of injury-related death in adults over 65. This is not a statistic I share to frighten you. It is a statistic I share because the scale of the problem matches the urgency of the solution, and the solution is not complicated. It is not expensive. It does not require a gym or a therapist or equipment. It requires 30 minutes of honest effort on a consistent basis for long enough to let the body do what it is remarkably capable of doing when you give it the right input. Your balance declined gradually. You were not aware of it happening because it happened in small increments over years, each one too small to notice, until one day you reached for a handrail that you did not use to think about and understood that something had changed. It will return the same way it left. Gradually, in small increments, each one too small to measure on any given day, building over weeks into something that you will absolutely notice. The first sign is usually that you stop thinking about where the handrail is. That is where we are going. Start today. Do the routine. Record your numbers. Come back in 6 weeks and do the tests again. I think you will be surprised. I am Dr. Clarence Martin. Take care of yourselves, and I will see you in the next video.